Good morning, good afternoon, and good evening, everyone. Thank you very much for joining this GTLL webinar. For those of you who don't know me, my name is Maddie, and I am the Senior Gender Advisor of ADRA Canada and the chairperson of the GTLL. And I'll leave the floor for Karuna and Sharmila to introduce themselves, please. Thank you.
I will go first. Hello, namaste. Good morning, good afternoon, good evening, everyone. I'm Karuna from Nepal, ADRA Nepal. Currently, I'm working as a Gender and Safeguarding Officer here in ADRA Nepal and co-chair for this GTLL. Thank you. Over to you, Sharmila.
Hello, everyone. I'm Sharmila Rhoda, and I'm the Network Program Coordinator at ADRA International, and I'm excited to see everyone here. Thank you.
Thank you both. Thank you very much again for joining this webinar, which is dedicated to the 16th day of activism against gender-based violence that takes place usually from November 25 to December 10. And the 16th day of activism run from the International Day of the Elimination of Violence Against Women on November 25 to Human Rights Day on December 10. And the 16th day of GBV activism, as you know, aims to raise and mobilize actions to end all forms of violence against women and girls. And for my information, different ADRA offices marked the date by conducting different activities, from running community campaigns to media work, and collaborating with different local actors to raise greater awareness on gender-based violence and call for action to end GBV against women and girls primarily. So as you might know, Somalia is one of the countries with a very high prevalence of gender-based violence, such as intimate partner violence, FGM, and child arrested forced marriage, partly due to its fragility, protracted conflict, and underlying gender norms. So this GTLL webinar will focus on lessons from ADRA Somalia and their experience in mitigating, responding to, and preventing gender-based violence across various settings. In the presentation, we'll discuss prevention strategies ADRA Somalia is using, focusing on addressing the root cause of gender-based violence and promoting cultural and systemic change. And it will also highlight the importance of collaboration among humanitarian actors, government agencies, community leaders, and international partners for effective GBV intervention. Just to say a few words about our presenter today, her name is Shamsa Noor, and she is the Senior Gender Protection and Safeguarding Officer for ADRA Somalia. And Shamsa is a very experienced professional committed to gender equality, social inclusion, and protection issues. Shamsa, in her role, plays a critical role in ensuring the effective articulation and implementation of gender protection and safeguarding strategies across multiple programs and sectors. And with over 3 years of experience in humanitarian and in development sectors, she has worked extensively on various projects focused on women empowerment, child protection, and community-based solutions for displaced affected population in Somalia. Before leaving the floor to Shamsa, let me say a few words about housekeeping. I would like all participants to keep themselves on mute so that we can hear the speakers clearly. Please also use the raise hand features to ask questions, or you can use the chat box to pose your questions, and we'll be followed on the chat box. I and Karuna will be facilitating this GTLL session. So now I will leave the floor to our Shamsa. Welcome, Shamsa, and thanks for your willingness to share ADRA Somalia's best practice on gender-based violence. I will leave the floor to you, Shamsa.
Thank you, Madi. Hello, everyone. As Madi introduced me, I'm Shamsa Noor, the Senior Gender Protection Safeguarding Officer in ADRA Somalia. I'll share my screen. I hope my screen is visible. So thank you for this opportunity. We as ADRA Somalia, we're happy to share this. And to addressing gender-based violence in Somalia, address experience. Sorry. This presentation explores ADRA's work in Somalia addressing gender-based violence, GBV, through a holistic approach. And we will delve into the scope of the problem, our multifaceted strategies, and the importance of collaborative efforts for lasting impacts. When we actually first look at the scope of GBV in Somalia context, when Somalia is being affected by conflict and displacement, we also have harmful cultural practices and lack of resources. When you look at limited access to justice, healthcare, and economic opportunities, this has impacted GBV, leaving survivors without adequate support. When you look at Somali GBV landscape, these are like the actual facts on the ground. Sadly, statistics show that 1 in every 3 Somali women experience some form of GBV in their lifetime. 54% domestic violence, including physical and emotional abuse, which remains a significant concern. 75% FGM, which is a harmful practice and affects staggering 75% of women, girls in Somalia. So when you look at the prominent forms of GBV, we have domestic violence, FGM, forced marriage, sexual assault, which comes from the conflict, and example is rape and sexual exploitation. ADRA's holistic approach to GBV mitigation and response. 1, prevention, promoting gender equality, challenging harmful norms and empowering communities to protect women and girls. 2, response, providing comprehensive service to survivors, including medical care, physical support, legal aid, and safe shelter. And mostly when it comes to response, we also reach out to different organizations through the referral mechanisms that exist. And thirdly, supporting survivors to rebuild their lives using different programs, access economic opportunities, and regain their sense of urgency. Root causes. When we get to transform harmful cultural practices by 1, community dialogue, facilitating open discussions and workshops to challenge harmful norms and promote gender equality, creation of awareness about GBV through community education campaigns and workshops, and 3, youth engagement. Sorry if I'm going so fast, you can try to let me know. One of the activities we get to do is tailoring services. Sorry.
You can take your time, Shamsa.
Thank you.
Yes. Yeah.
So when is conducting gender analysis need assessment. Before the project, we get to conduct a gender analysis, get to understand the needs of the community and the targeted intervention, which will definitely make sure that the resources are allocated effectively. And key effective GBV response. 1, partnering with community leaders and government agencies. As some of you may know that Somalia, when you look at the laws and policies, mostly the laws are drafted, they're yet to be implemented. So every time we get laws that are drafted, like the Sexual Offense Bill, Children's Act, but mostly we don't get it to be implemented. But at the end of the day, we need to engage with the government agencies to make sure that legal frameworks and ensure survivors have access to justice and protection trainings and policy development. When you look at community engagement, as ADRA Somalia, we work closely with community leaders and elders to address GBV within their own context, fostering collective ownership. Mapping existing GBV services and referral pathways. This is something that has really helped us in terms of ADRA Somalia, whereby most of our programs are not like specifically a protection program unlike the other organizations. So what we normally do is we get to conduct a referral mapping, whereby we get to understand within the programs where they're being implemented, we get to conduct a referral mechanism, which also helps us to make sure that if a survivor in a WASH program, one of our beneficiaries in an education program, we get to have the referral mechanisms in place to make sure that they get to access services when need arises. When we conduct a comprehensive assessment of existing GBV services and resources, whereby we get to identify gaps in services provision and referral pathways, particularly in emergency settings, since most of our programs are like emergency settings. And then we develop a coordinated referral system to ensure seamless access to appropriate services. When I say these referral mechanisms have really helped us, when at the end of the day, we need to make sure that these referral mechanisms are translated in our local dialects, whereby it helps us, like they get to understand it within the grounds. And secondly, they get to be printed out and put in all the places where our programs are being implemented. And then Gender Advisory Committee. With different programs that we're implementing in Somalia, we get to have a Gender Advisory Committee, whereby we make sure that most of the representation are women. And the highest percentage of women in the Gender Advisory Committee has really helped us, whereby at the end of the day, the frontline women are being educated and they're capacitated and they're given different trainings on protection, GBV, and they get to make sure that they also go back to the community and train the other community members. So our women representative in Gender Advisory Committee, that's the highest percentage. And they get to have informed decision-making in our programs, in different programs, whereby women are directly involved in ensuring that programs and policies are tailored to address their specific needs and experiences. And when we look at the informed decision-making, this is whereby we are able to curb also sexual exploitation and abuse. In case any incident occurs, these are the women who are already informed on their rights and their responsibilities in the Gender Advisory Committee. They reach out to different program officers in our programs where they're being implemented. Also, this Gender Advisory Committee has enabled us to foster greater accountability and transparency in the implementation of GBV interventions that we have on the ground. Another GBV intervention we have is community engagement and raising awareness activities. When community mobilization, we engage with local communities, leaders, and influential figures to raise awareness about GBV. Information campaigns whereby we develop and disseminate targeted information such as the referral mechanism, the IEC materials, and different campaigns like the GBV Awareness Week using culturally appropriate methods. And thirdly, community dialogue. We facilitate community dialogues to challenge harmful norms and promote positive attitudes toward GBV prevention. Capacity building for frontline responders, which include child protection focal persons that we have in different our education programs, the community feedback mechanism focal persons, and the Gender Advisory Committee. So these frontline responders are trained on GBV prevention, identification, and response protocols. We develop training materials which are tailored to the specific needs and context of emergency settings. With the Learning Lab, we have the trainings on GBV, whereby it's more of Islamic context, and we use that one. We've been using that recently to make sure that these training materials reach out to the community. Because when you look at Somalia, mostly we tend to look at the GBV issues that are in the community. And when previously when we do the trainings, we won't have the specific scriptures in our religion because ADRA Somalia is mainly Islam. So we won't have the scriptures to make sure that the community gets to understand that this is more of cultural issues that are affecting the community, but not more of a culture or more of a religion. So using the materials that were used, that were shared using the Learning Lab, we get to use those materials to make sure that the specific needs and contexts are shared in the community. Thirdly, we provide ongoing support and supervision to ensure effective and ethical services are delivered. And this comes about the code of conduct that we have as an organization, the sexual exploitation and abuse policy that we have in the organization, and the safeguarding, and as well as the GBV policy that we have in the organization. So whenever we implementing projects, we make sure that there's support and supervision to ensure effective and ethical services delivery. Community-centered reporting mechanism. You can see in one of the pictures that I'm using here, it's written in Somali language. this is one of the reporting mechanisms that we use, the hotline number. So we get to print them out and distribute them in the community, and we get to make sure that the community are aware of the reporting mechanisms we have in place. So the reporting mechanism, apart from the hotline number, we have the community focal persons, and we also have the child protection focal persons. So these community-centered reporting mechanisms are tailored to make sure that they're designed with community input, ensuring they're culturally sensitive, accessible, and confidential. And we as Somali, we are oral community. So this hotline has really helped us because we get to share information and the community members are willing to talk about the issues that are facing. So when you look at empowering services, safe and accessible reporting channels, which are empowering survivors to seek help, promoting accountability and break the silence around GBV. Focal persons and feedback mechanisms. And this is like the best mechanism we've adopted as ADRA Somalia, whereby we have child protection focal persons. Not only these child protection focal persons teachers, they're also from the same community that they're representing in those schools. So these child protection focal persons are well trained, and they get to have sessions with the children on different topics, be it GBV, be it child protection, be it child abuse. And they also go back to the community and have the same training and conversations with the community. So the focal persons, the child protection focal persons are also the community feedback mechanism focal persons in the schools. So they're able to provide essential support and guidance to vulnerable children, ensuring their safety and well-being. And then community engagement, the complaint feedback mechanism that we have as an organization directly came from the community. And this encourages active participation in reporting and addressing GBV concerns, creating a culture of accountability. So as the picture as well, we had the GBV Activism Week, which we'll talk about later. So this is in regards to the child protection focal persons. Role of GBV protection clusters is ADRA Somalia. We're involved and we get to take part in different protection clusters. We take part in the protection cluster GBV area of responsibility, sexual exploitation and abuse network team. So this one has enabled to give us a platform whereby we are able to address the root causes of GBV in Somalia as a team through community-based initiatives, promoting gender equality and challenging harmful norms. As Somali, we have this proverb whereby we say, one finger cannot wash, one finger cannot wash the face. So as it means that when it comes to fighting GBV in the community, we need to address it as a team. So ADRA Somalia gets to be part of all the coordination groups in Somalia, the cluster that I've mentioned. And this has also enabled us to respond immediate support to survivors, including medical care, psychosocial support, and legal assistance. And it has also enabled to address the gaps that we have as an organization, whereby if we are not able to provide legal assistance using the protection clusters and the referral mechanisms that we share as a team, we're able to reach out to them easily because we're already part of the coordination team. And then it has facilitated easily collaboration among humanitarian organizations, government agencies, and local communities to ensure a comprehensive and coordinated response. Thank you. Any question from there?
Maddie, you're on
Maddie, you're-
mute.
I have my kids at home, so I make sure I mute my speaker every time. So thank you so much, Shamsa. It was such a great presentation. And hopefully our participants gain some lessons from your experience. But now we will leave the floor to Q&A. If you have any question, please feel free to read these questions, or you can also use the chat box alternatively. Thank you.
So If anyone doesn't have any question, oh, okay, that is the question. Maddie, you are in mute.
So Pip has, I think, a question. Would you please check out the chat box?
Okay, Sophie has question. Okay, I think it's for the Samsa. Have you seen any negative backlash from men when trying to address GBV? And have you also seen male GBV survivor? If so, how you have dealt with that mixed survivors? Samsa?
Thank you.
Yeah.
When you look at
Would you please open your video, Shamsa? Sorry.
sorry. Okay. When you look at GBV in Somalia in general, leave alone GBV, when it comes to any gender project that it's being implemented or any protection projects that are being implemented in Somalia, what happens is you have to do men engagement and boys engagement first, because those are story that we had. Like, for example, when you're implementing a project and you say that you're mainly targeting women, 100% you'll have a backlash. But what we normally do as ADRA Somalia, we get to, with the different capacity building that we conduct, there's also part that we do men engage and boys engage. So through this and the gender advisory committee, however much the highest percentage is women, we get to have men as well there. So we are yet to experience any negative backlash from men. This is due to the different capacity building that is done when we are conducting men engage programs and boys engage programs, whereby we have different capacity building for them, and they get to understand however much this project targets before the implementation of the project, however much this project targets women, it also has a positive impact in the community as general for both men and women. So we are yet to experience any negative backlash, and this is because of the different capacity building that we conduct in the community and the fact that we have the gender advisory committee that entails men, so they get back to the community and get to educate them as well on the need of the projects. Thank you. Oh, there's another question. Have you seen male GBV survivors? If so, have you dealt with that? Mixed survivors? No, yet we haven't had any male GBV survivor in the programs, but with the different cluster groups that we've interacted with, the different organizations, they're normally GBV male survivors. And it's a gap in Somalia whereby different GBV shelters and different safe homes are not made to target male. They're mainly targeting women. So there's that gap in general when it comes to Somalia. But different organizations such as IOM, they have programs that help the male survivors. So as the staff members in ADRA Somalia, we're equipped with the different referral mechanisms where we're able to understand if we get to have a male survivor in our beneficiary programs and different projects, where we are able to refer them, such as IOM and the different medical places that we have in ADRA, in Somalia in general. Thank you. I hope I've answered.
Yeah, yes, we have another question as well. That's from Jamie. Are there any key differences you would consider for a non-emergency setting? Samsa?
Sorry?
Yes. Yeah, there is another question that are there any key differences you would consider for a non-emergency setting? Is it because it's more about, I talk about the humanitarian setting, but it's not emergency setting as well. If there are any key differences you have faced that during the implementation of the program?
Oh yeah, however much we have, most of our programs are more of emergency settings. We also have other programs such as the WASH program and the education program that are mainly not non-emergency setting. So yeah, the other key differences we'll consider as an organization. There's another question.
Yes,
Did the government
Yeah, there is another question as well. Can you tell a bit more about ADRA's role as a member or part of the clusters?
Oh, yes. As I said, we have different clusters, such as the Sexual Exploitation and Abuse Network Team, the Protection Cluster, and the GBV-AOR. So when you look at, I'll talk about the GBV-AOR. We have the national cluster, and then we have the different states clusters, and ADRA takes.
What AOR? Would you please define? It's
GBV area of
responsibility. Yes.
GBV
Sorry?
area.
What is that full form of?
GBV area of responsibility. So we have the national group.
Yeah.
Yeah, so we have the national group, and then we have the state level group. So for example, we are currently having Jubaland is experiencing, which is a state is experiencing some political instability. So we recently had an incident in Raskamboni whereby there are a lot of cases that are being reported. So through the GBV-AOR, in Raskamboni, as ADRA Somalia and the other organizations, we come in as a team to make sure that there's a collective support. So if we as ADRA Somalia, we come across a survivor that requires medical support, we know where to get them. So ADRA's role in the clusters, one is helping the capacity building, coordination, sharing materials. And then, for example, the sexual exploitation and abuse, we get to have messages that are being shared by the cluster on different languages, different dialects, because like in Somalia, we have 2 dialects, the Maya and Mahatiri. So when those informations are being disseminated, we get to make sure that also the other community members in different places that we implement our projects get to have the same information. So ADRA Somalia, apart from the capacity building and the trainings we help in the clusters, we get to make sure that the GBV Awareness Week, any international forums that we are having as Somalia, we take part in it. And if need arises when it comes to funding and if they need materials to be developed and all that, we always ready as ADRA Somalia to help the different clusters. There's another question. I hope I've answered that one. Did the government fully support ADRA's work on this? What happens in Somalia is when you yet to implement projects, we make sure that the government are in loop. We get to share the information with them. We get to share the projects, the log frames and everything. So the government is already aware of all the projects that we get to implement. In Somalia, you cannot implement a project without informing the government. So they are always fully supportive of ADRA's work. And without the government support, definitely we could be having insecurity issues, which we are yet to experience. So yeah, they fully support ADRA's work. Thank you.
Thank you, Samsa. Thank you for addressing all the questions raised in the chat box. If anyone has a question, queries, please feel free to ask. And
I have
in the
one
meantime,
question.
I also have one.
I have one question for Shamsa.
Yeah.
So in the Islamic context, we know that religious leaders such as the imam, the sheikhs, play a lot of role in terms of influencing the community, right? So have you used these traditional religious leaders to take part in your fight against gender-based violence? Because normally wherever there is a conflict at the household level, people tend to first go to these religious leaders than going to the police or other legal services. So in what way did ADRA Somalia involve these influential religious leaders in the fight against gender-based violence?
Thank you, Madi. As you mentioned, in any GBV issue or any incident and protection-related issues, we as Somali, we first run to the religious leaders, and they're always aware of everything that is happening in the community. If there's a group of people that are very important when we are tackling GBV issues in Somalia or any protection issue in Somalia, religious people are the first people we handle. We get to meet with them as well. So any creation of awareness or any capacity building that is being conducted in different programs, be it WASH, be it education programs, be it protection trainings, any that we handle, we get to make sure that religious leaders are also involved. The participants, we always have religious leaders, we have community elders who are also important in Somalia context. So those are the people that we get to tackle and involve them in different trainings and capacity buildings that we handle. Without religious leaders, I feel like we couldn't be able to do anything, because they're the people who have all the information in the community. They're aware of all the scriptures that we have as a Muslim country. So they're the ones, mainly when you look at Men Engage and the fight during the zero tolerance to FGM, during that period of zero tolerance to FGM, they're the ones we reach out to, because they can use their space that they have during different periods of prayer time. They get to have the talk with the congregation. So we always have them also in our capacity building agendas. Thank you.
Thank you so much, Shamsa. It was really helpful.
Yeah, I also have one question.
Yes, please, Karuna.
Yeah, you talk about that gender advisory committee. So I just want to know that the gender advisory committee is already there in our community, or the project formed that committee. So I just want to know about this gender advisory committee. Could you please elaborate that? Because it's quite helpful.
Thank you. For example, when we are having a project that is being implemented in Puntland, which is one of the states in Somalia, and we have a cash assistance projects that we implement there. So what happens is we get to have a gender advisory committee, and where we encourage, and this is like fully community participation, whereby it entails community leaders, it entails advocate women that are in the community that really talk about these issues that are in the community. So we encourage 80% to be women and 20% to be men. And this is because mainly the cash assistance projects that we implement are targeting women. So this gender advisory committee, they're from that specific community that we are implementing that specific project. And during all the project implementation, monitoring, evaluation, all that, the community, the gender advisory committee are always involved. So what they have really helped us with is like anytime they have a capacity building, anytime we are having the IEC materials distribution, we get to first reach out to them, and then we get to reach out to the community. And some of the gender advisory committee are also some of our beneficiaries. So in case there's any issue when it comes to the cash assistance projects that we're being implementing, those beneficiaries can speak up. They can reach out to us using different project officers, using different reporting mechanisms that are put in place by ADRA Somalia. So the Gender Advisory Committee, apart from going back to the community to educate them, they also keep us as ADRA Somalia on toes, whereby in case of any implementation issues that we're experiencing, they get to report to the community. They give us feedback, be it a request, be it an appreciation. The Gender Advisory Committee is something that has really helped us as an organization with the different projects that we're implementing. When it comes to the WASH projects, we have the coaches, whereby the different girl-friendly spaces that we have as an organization, we have coaches. Those coaches are able to go back to the girl-friendly spaces and have different sessions with the children on menstrual hygiene management, on child marriage, on FGM. So these are the people that get to have information from the ground and are able to share with us. And anywhere that ADRA Somalia cannot come in, we use the referral mechanisms to make sure that these survivors can get help. And the staff are aware of the referral mechanisms and the different coaches. Thank you. I hope I've answered.
Yeah, thank you.
Is there any more questions?
Is there any more questions? I think there is no question in the chat box.
Shamsa, would you please elaborate how you are coordinating with the schools to sensitize the children who are the next generation on gender-based violence and the issue of consent, the issue of safe relationships, So how do you do that? Because you know, those school children are also serve as a bridge between the school and the community, and to have consistent messaging across the board. So how do you engage schools? How do you engage school clubs for GBV prevention?
Thank you. Before I get to answer, I'll give an example. We were doing an evaluation for a project that ended. So I was very new with ADRA Somalia. So I went during the implementation of the project, I was not there, but now I joined in later during the end of the project. So we were able to go to one of the states and we were conducting a field visit with the officers and the project managers. So as a young Somali girl, we never used to have communication on menstrual hygiene and what are sanitary towels and how to use it and how to manage painful crampings and all that. We never used to have that conversation back home. So when you get to hear this is just among our peers, whereby you get to hear one of the classmates is sharing what she went through, and it's actually still a taboo, however much we like still having that conversation. So at least we improving from when we're growing up to what the younger ones are experiencing now. So what happens with the schools on how, I was telling a story, sorry. So when we went to the field visit, what happened was one of the girls, when we were trying to ask her how the girl-friendly space has really enabled to like helped her in her performance and in her education, what she shared was that before she had to leave mid of the classes to go home and make sure that she gets to manage and get to change her sanitary towels or skip school. But now that they have the girl-friendly space, they're able to use that space to like do whatever they want to do and get back to school. So that period that she was missing classes, it would like make her not perform well. But the girl-friendly space has really enabled her to like perform. So what I'm trying to say is before we couldn't speak about that because it was a taboo that we couldn't even address it. But now having a coaching in the school and having the child protection focal persons has empowered her enough to even stand in front of the people and talk about menstrual hygiene, which was already seen as a taboo in the community. So, Madi, to answer your question, the child protection focal persons have really helped us as an organization because they get to have different sessions with these children in the schools that we are supporting. And we have a tool that we developed as ADRA Somalia, whereby they have different topics in a month, they get to have 4 sessions with the children. So those 4 sessions, they're already, as a child protection focal persons, they're already trained on it. And anytime they need help from ADRA Somalia, they always reach out to us. And monthly, we have to have the records from the child protection focal persons from the schools that we are supporting as an organization. So those different sessions have on how to manage in discipline, positive discipline, on how to manage emotions and anger and child protection, child abuse. So this is empowering these children so that they can able to speak up in times in case there's a child being abused, or in case there's a child marriage happening in the school. However much it's not to them, it's to another child, that they know this is something that is not right. So having the child protection focal persons on the ground, it has enabled these children to know this is an abuse, or this is not an abuse, this is right and this is not right, because of the different trainings they're having in those 1 month. As I said, they have 4 sessions. So with those 4 sessions, they get to understand, is it a follow-up session that they're having, or is it a new topic that they're having to discuss? And the different child clubs that exist in the different schools that we have, they also have a tool that they're using to make sure that these children, with the different child clubs that they're having, so this has enabled them to have those peer-to-peer sessions with the fellow children. So this peer-to-peer has, we as ADRA Somalia, we say like mostly when we are doing a training, it's normally like a lecture thing, but we don't encourage the lecture training. So this peer-to-peer learning has enabled them to share information, whereby this child protection focal person from this specific school gets to meet another child protection focal person from a different school during the workshops and the trainings that are having in general. So they get to share information, because as Somalia, we're just coming from a conflict. So there's a lot of trauma, there's a lot of mental health that is being needed. And the children already coming from a GBV background, from a traumatized background, they already face different issues. So when they come to school, it becomes a safe environment for them because they can easily access the referral mechanisms. They can easily access the different reporting mechanisms that are put in place. They can have access to the child protection focal persons. They can have access to the different project officers that are implementing projects in the ground. So this is like a very passionate thing that we are doing as an organization, whereby it has really enabled this next generation. Because when you look at GBV issues with the different projects, what people do is they train the elders, they train persons with disability, they train the women, forgetting that we are bringing up a different generation. So if we do not have sessions with these children in schools, we do not have sessions with the youth, definitely we'll have a gap in 10 to 15 years to come, because this is going to be our next generation. So as ADRA Somalia, we get to have these education programs that we're implementing, and these children get to have different sessions. And they get to give us ideas on the risk assessment that we conduct as an organization. We get to understand, when we talk to them on the risk registry that we do annually in every school, they get to talk about different risks that exist in the schools. And the risk assessment is normally a child-led risk assessment, whereby these children take charge, they participate in the risks, they identify with us the risks that exist in school, they map out the risks that exist. And the mitigation action mostly comes from those children, because they know they're the ones who know the school better than us and the teachers. So the risk assessment is also something else that has really helped us. I hope I've answered. Thank you.
Thank you so much, Shamsa. I can see that ADRA Somalia is doing a very holistic and comprehensive GBV response and prevention, reaching out to different stakeholders at the community level, like individuals, women and girls themselves, and the community represented by, phase leaders, as well as institutions, including schools. So thank you very much for sharing that experience, Shamsa. Are there any more questions? There are no more questions. We have 10 minutes, and I would like to devote this 10 minutes just to get few information on how other ADRA offices mark the 16th day of activism against GBV. So Shamsa, first let me start from you. So how does ADRA Somalia mark or commemorate the 16th day of GBV activism against GBV? Like, how do you do it?
With ADRA Somalia, we had two activities. One activity was a general state GBV activism week, whereby different organizations and the community were able to participate in it. So this was one of the activities that were marked in Somalia, whereby Jubaland State was able to have a commemoration on GBV activism week, one general activity, whereby all the organizations were able to participate in the community. And secondly, we used our different education programs, whereby together with the child protection focal persons, we were able to have a session with in different schools with the children, whereby the children, the girls and the boys, whereby age from 12 to 16 were able to have monitoring child-friendly GBV activism week, whereby they were able to talk about the impacts of GBV, what GBV are, and this was how we marked as an organization. So it was one of the outcomes whereby awareness of GBV prevention among children was done, and the strengthening of reporting and referral pathways for the children was also done. This has also enabled to reduce stigma around discussing and addressing GBV issues. As I mentioned earlier, things to do with GBV when it comes to our country is like a taboo, like it's barely talked about. So using the child protection focal persons and the education programs that we have, whereby they use child-friendly approaches such as role plays and storytelling techniques on GBV. That was the main goal that we had in education GBV Activism Week, whereby awareness of the children was promoted, empower them to recognize and report any violation in a safe and supportive environment. Those are the two activities that we conducted at ADRA Somalia. Thank you.
Thank you so much, Shamsa. Karuna, I know also ADRA Nepal has done great efforts to commemorate the day. So would you please brief us within 1 or 2 minutes, please?
Okay. Yeah. Yes. Thank you, Maddie. Yes. 16 days. This global campaign. To mark this campaign, ADRA Nepal and its implementing partners have organized various events in our project areas especially to raise awareness about GBV, strengthening prevention, reporting, and response mechanism. So mainly, our intervention was focused in awareness rallies and the folk song competitions on especially the theme for this song competition is the GBV awareness and the rights of people with disabilities. Another is we have conducted the street dramas on GBV, how the GBV prevention and response will look like. And another is we have conducted the awareness raising sessions at school. We have more than 17 sessions were conducted in different schools. And another is inter-school quiz competition was also conducted during that time. And the quiz competition is also, the questionnaire is also related to the GBV and the law policies related to GBV and the gender. And another is that we have conducted the informative interaction session with the farmers group that our project participant in different groups. Our project team has conducted the awareness sessions and the referral mechanism as well. And another is that we have public service awareness message, PSA. Message is broadcasted to our local radios, and the hoarding boards and brochure were also printed at that time. And another is one event is that we have also in our another one of the project we have appreciate the family members of the people with the disabilities who took care of the people with the disabilities. So those are the major intervention or the activities that we have conducted during this 16 days of activism. And I think that the best practice, for us, that the good practice we have observed during this program is mainly that community engagement is high, because we have conducted the different thematic activities for the awareness activities. Like for the farmers group, we have conducted the interactive session. For schools, we have conducted the quiz competitions, and for the women's group, we have conducted the song competition. So different these thematic activities will quite effective, relatable, and impactful. And another is that leveraging resources with the local government is also one of the major best practices that we have seen, that because we have a very limited budget in the project, but our project team has able to leverage the fund from the local government. So it helps us to the effectively successfully implement those initiatives that were planned to mark that activism. And another is like as I already said, the tailor-made program to the local context enhance that the relevancy, and it also encourages the community involvement. Yeah, thank you.
Thank you so much, Karuna. So we have 5 minutes before we conclude this GTLA. So I think Karuna will give us the final remark.
Okay, thank you again, Maddie. Yeah, thank you. Thank you for sharing your experience in addressing GBV in Somalia. Thank you, Samsa. And yes, indeed, that GBV is indeed a critical issue that needs the urgent attention. It's not only in the humanitarian setting, but also in the regular development program as well, to ensure its long-term sustainability and for the societal transformation as well. So I think you have covered the experiences from the ADRA Somalia, the different intervention you have done to for the prevention and the response mechanism. So Additionally, that multi-sectoral, you have also highlighted the multi-sectoral approach, which is crucial to provide holistic support to the survivors, and it also helps to address the root cause of GBV, that like the school intervention and work with the religious leaders. So, and collaboration among stakeholders, gender advisor committee, and other local leaders, local community leaders is essential to drive systematic change, and also it ensure that no one is left behind. Thank you for highlighting on this important issue. I think that's all from my side. Thank you again, ADRA Somalia and SAMSA for the time and for the presentation. And I would like to thank all of the participants for their participation, for joining our TLL as well. And also, I just want to add one thing, that if you are not part of our COP, this ADRA GTLL, please join us. This platform, it's a platform that we can learn from each other. That's why, at the behalf of ADRA GTLL, I'd like to request all to join our TLL. Yes, thank you, Maddie, and thank you all.
Yeah, thank you so very much, everyone. Thank you so much for the active participation, for the interest. So as Karuna was asking, would please go ahead and sign up for this GTLL membership. There's a lot of sharing, there's a lot of learning happening. So we'd kindly request everyone to share the membership information to other partners, to other colleagues as well. So thank
And
you.
Sarmila has also shared the link for this
Yes.
COP. So please go ahead.
Yes, yeah. Please use the link to get registered or to sign up for this GTLL. So we have 2 minutes before we conclude this session. Thank you everyone again for joining, and hopefully you get a lot of learning that can be replicated in some of your projects, both at the humanitarian and development context. So thank you very much. Thank you also, Sharmila, for the logistics. Thank you so much, everyone, and have a great afternoon and a great evening. Thank you, Shamsa, again. Thank you, Shamsa, very much for sharing your experience. Yeah, it's much appreciated. Yeah.
Ready. Bye.
Okay, bye-bye, everyone.